friends, Dr. April Kern here. Let's talk about flossing. So most of my patients, when I ask them if they floss in the dental chair, they'll say, no, not really, which I appreciate the honesty, or they'll make a joke and say, yeah, I flossed yesterday because I know I was coming in today. Well, the truth is nobody likes to floss. I don't like to floss myself, but I know that we have to do it to keep our teeth and gums healthy. So why do we have to floss? Because there is no toothbrush invented, and all the companies say they can, that actually gets the plaque and the bacteria out from in between your teeth. So you still need to floss right between the teeth to pull out that bacteria. Okay, so there's all these different types of floss. If you watch my other video where I went shopping down the aisle of CVS, you can see there's a huge variety. So I'm just gonna break it down into a couple of different types. So number one, it's called like a proxy brush. You can see that there. Okay, it's almost like a little pipe cleaner, and it comes on like, these are the refills here, and you go in between the teeth, okay? You're not going down like floss, but you go in between the teeth to pull out like bigger particles. Like if you have like a space between teeth, proxy brushes are really good, and a lot of patients like those. And then there is a water pick or a water flosser. I love water picks. Here's a portable water pick, okay? So these are not a substitute for floss, rather it's an adjunct. So you still need to floss, but then this flushes and irrigates out, especially if you have gum disease where you have like bigger spaces between your teeth and your gums. It's really good, not only to floss, to go down a couple millimeters, but to irrigate and really get everything out from between the gums. And then we also have, for flossing on the go, the handy dandy floss picks. I love these things. They're like little swords or whatever you want to call them. They come flavored sometimes. Great to keep in your purse, in your bag. Kids, they're really easy to use. Kids like them. Patients that don't have really good like manual dexterity, it's hard, like arthritis, hard to get back there. I love floss picks. It's better than a lot of the other products out there. And then the old standard is, of course, string floss, dental floss. I always tell my patients, I like Glide, okay? You don't need to go getting like super fancy flavored brand unless you want to. I have some other product recommendations in my comment section below. Make sure it's waxed, otherwise it's gonna get stuck between your teeth. And a lot of patients say, my gums bleed, that's why I don't floss. I don't wanna floss because they bleed. Well, they're flossing, whenever you're flossing, you're actually removing the bacteria, and there is gonna be some inflammation at first, so you're gonna bleed at first, but then the more you floss, the less you'll bleed. So don't let bleeding scare you out of flossing. And then the other question, which I get all the time, all day long, is when should you floss, okay? So usually I say, I'm not too picky, as long as you floss once a day, that works for me. And then patients say, hey, I wanna be like an A+ student, tell me when, and I'll say, okay, floss first to remove that bacteria between your teeth to kind of loosen it up, and then brush. So it's floss and then brush. Okay, hope you learned something. Happy flossing. Thanks for watching. Don't forget to like and subscribe for more videos.